Hello, I'm Amanda Hoon, registered dietitian with WellSpan Bariatric Surgery. Today we're going to talk about bariatric surgery-related nutrition recommendations. This is the nutrition session number 4 out of the 6 video series. Today we're going to talk about fluids, hydration, protein, vitamin and mineral supplements, and what the recommendations are for those. And then we'll talk about some GI concerns that a lot of patients experience after surgery or potentially may have after surgery, which will include dumping syndrome, lactose intolerance, and constipation. So there's 3 priorities after surgery. You want to make sure that you stay hydrated. You want to make sure that you're getting 8 cups or 64 ounces of fluid regularly. Ideally, those fluids should be calorie-free, caffeine-free, and be non-carbonated. Okay, so that would include you can have water, broth, sugar-free jello, sugar-free popsicles. You can have Mio, Crystal Light, any of those little flavor packets that you add to water. Some patients really like to have water with fruit infused in it, so you can add strawberries to it or cucumber, and that kind of gives the plain water a little bit of extra flavor. It might be a little bit more appealing for you. And no soda, absolutely no soda after surgery, and it doesn't matter if it's regular or diet. The carbonation can irritate your stomach and cause some issues. You can also have herbal tea, decaf tea. Herbal teas are naturally decaffeinated, so you wouldn't necessarily have to look for a decaf version. But coffee you can drink as long as it's decaffeinated. And then regular tea would also be recommended to have as a decaffeinated version. Okay, sugar-free lemonade would be another option. Powerade Zero or a Gatorade Zero, Propel. So lots of options in terms of beverages that you can have. It's just a matter of finding something that works for you that you like. Okay. And you want to constantly make sure that you're sipping your fluids throughout the day, because you're not going to be able to eat and drink at the same time, so you want to make sure that you're getting your hydration in between the meals. Okay, so and that's that 30-30-30 rule. So make sure you stop drinking a half hour before the meal, don't drink with the meal, take a half hour to eat, and then wait 30 minutes after the meal before you start drinking again. And straws are also not recommended. So if you are one to avidly drink through a straw, I would recommend that start practicing drinking normally through a cup, or you might need to switch out your water bottles and make sure that they're ones that don't have straws. Now, this might not be something that you forever have to do, but sometimes as you're sipping through the straw, you might ingest a little bit more air, which then kind of puts a little bit more gas into your stomach, and it can be uncomfortable. It's not going to hurt anything or damage anything, but it can be uncomfortable. I wanted to demonstrate for you today how the 30-30-30 rule works. So you stop drinking a half hour before a meal, you don't drink with the meal, and then you wait 30 minutes after the meal. So I wanted to demonstrate for you why exactly that is. So we have here, this is a jar with some applesauce on the top of it. This would demonstrate the fact that your stomach is significantly smaller after surgery. So when you have a meal, you make sure you chew your food well enough to the consistency of applesauce, which is why I have the applesauce here. So you want to make sure that you're chewing your food rather well to this consistency, and so that way when it gets into your stomach, it actually fills up your stomach enough that you feel full and satisfied. Now, the reason why we don't want you to drink too soon before is so that way you don't end up filling up the stomach with the liquid and then you can't eat. And then take the time to not drink with the meal, because even if you were to just take, I have a cup of water here, even if you were to just take a sip, you can see that, the applesauce is just kind of very slowly dripping through, but then there's a little sip of water. All right, maybe another sip of water. And you notice that it's already starting to drip through a little bit faster. We add another sip. And the applesauce started to mix with the water, and it poured through through the funnel a lot faster, meaning that in your stomach it poured through, it entered into your intestine much faster. When that happens, you're now going to feel hungry again. Okay, and this can lead to snacking in between meals. It can lead to snacking in the evening. And then you never really have that full satisfied feeling, or it doesn't last for as long as you would want it to. So ideally, you would want to make sure that you stop drinking a half hour before the meal to allow the liquid to pass through your stomach and to empty out. So that way, when you do go to eat a meal, you can fill up that meal or fill up the stomach with your food, and that way you get the nutrition that you need, the protein that you need, and then feel full and satisfied. So then that way, once you wait a half hour, the food has already started to transfer into your intestine, and then you can and then you can start drinking again. So that way you can keep making sure that you're getting hydrated throughout the day. Okay. All right. And then there's a little bit in that stomach left. There you go. And then you see it just funnels right through. So as we've demonstrated with the applesauce here, we noticed that it went through the stomach a lot faster when you had when you added the liquid to the solid. So there's other foods that you might be the same premise. So if you were to have, say, cold cereal, for instance, if you were to have cold cereal, you're taking that solid cold cereal and mixing milk into it, which is a liquid. So with cold cereal, you're essentially eating and drinking at the same time. The same would be true for soup. So for instance, when you have a chicken noodle soup or even just a beef vegetable or a chicken vegetable soup, the same concept is still relevant here. So you have solid food that you mixed with the broth, and now that broth is going to make that solid mixture soupier. So meaning that it may not be very filling, and it may allow you to eat the meal. It might be comfortable to eat the meal, but then you may not feel very full, satisfied for long enough that you might need to end up snacking later on in the day or in between the meals. So making sure that when you're eating a meal, you're having protein with every meal, and that way it'll allow you to feel full and satisfied. You can include your vegetable, and if you have room yet, you can still include a small portion of starch. But ultimately, protein first. Make sure you're not eating and drinking at the same time, and then wait the half hour before the meal and wait the half hour after the meal before you would start drinking again. So after fluids, you want to then make sure that if you are drinking alcohol, that you wait as long as you possibly can if you reintroduce it at all. Obviously, the alcohol can be an irritant on the stomach, so again, that may not feel very comfortable, and you're not interested in, generally patients aren't really interested in feeling uncomfortable after surgery, so this might be an irritant that hurts. Okay. In addition to the pain or the discomfort that you might experience, you may also get drunk a lot faster. So the alcohol metabolizes a lot faster than what it would prior to surgery. So you could be intoxicated with much less alcohol, but it might hit you a lot harder. Okay. So be very careful that you're not drinking alcoholic beverages regularly. They do contain a lot of calories. Some of them are mixed with juices. Some of them are mixed with sodas, which soda we talked about already isn't recommended. Juice isn't recommended because of the added sugar in it. So it limits the alcohol that you have available in terms of options. Beer is out because it's carbonated. So be very careful that if you are going to reintroduce alcohol, that you wait as long as you possibly can. And the first time you have something, make sure you do it at home and that someone's with you. Okay, knowing that you may have some discomfort and you may be legally intoxicated with less amount of alcohol than what you might be used to prior to. So fluids we talked about as one of your 3 priorities. Your second priority is to make sure that you're getting an adequate amount of protein. The protein is important for preserving lean muscle mass, and it also will help with potentially minimizing the hair loss that you might experience after surgery. You can't completely stop that from happening because it's a stressor. Surgery is a stressor on your body, and your body's reaction to the stressor that surgery caused can contribute to the hair loss. So eating an excess amount of protein isn't going to make the hair loss go away or minimize it completely or stop it completely from happening. Okay, so you want to make sure that you're getting in the protein so that way you preserve your lean muscle mass. Your objective with surgery is to lose fat, not muscle. Okay, so in this rapid weight loss phase, you want to make sure that you're preserving your muscle, and that way you can maintain some strength. If you aren't including protein with each meal, you may feel hungry throughout the day. You may feel unsatisfied. It may lead to snacking in between meals or in the evening. Okay, so make sure that you're getting 60 to 70 grams of protein a day. The easiest way to identify a protein would be whatever comes from an animal. So easiest way to identify a protein is if it comes from an animal, it's probably a protein. So your dairy products, meat, fish, those would be your protein sources. In your handout, in your session handout, you'll notice that there's a list of protein options. And on that list, what you can do is if you have a highlighter or a pen, go through and highlight or mark off the protein options that you like, just so that way you can start to identify what your variety of protein likes and dislikes are. And that way you don't feel like you're so limited after surgery, because you also have seafood and shellfish. So assuming that you don't have any allergies, you have a lot more options. Okay, so that could be helpful to help identify some protein options afterwards. Your third priority after surgery, so make sure that you get plenty of fluids in and stay hydrated. Protein with every meal. Okay, protein with every meal. Even if you need to have a snack, you can include a protein with the snack. The third option, or the third priority after surgery, is making sure that you're taking your vitamins. So every day after surgery, you have to take vitamins. You've just had a procedure that makes your stomach significantly smaller. So you're going from a stomach that's the size of a football to the size of, for a gastric bypass, would be about the size of an egg. For a sleeve, the stomach would be, instead of the size of a football, it'd be about the size of a banana. So significantly smaller, which means that you can't tolerate a whole lot of food. There might be some foods that you can't tolerate at all, some food groups that you may not be able to tolerate. So then you miss out on those nutrients. And then if you're only able to tolerate so much at one time, on top of that, for a gastric bypass, whatever you did take in, you may not actually absorb 100% of. So now, in addition to not being able to eat certain foods, you're not going to absorb it, which is where the vitamin and mineral supplements are going to come into play and kind of bridge the gap on what and provide you with the nutrients that your body can't otherwise get from the actual food. Okay, so supplements are imperative after surgery every day for the rest of your life. There may be some supplements that you would need to increase the dose of. There might be some supplements that you may not need in high of a dose. So based on labs, we'll alter, whether it be the surgeon or the diet or your registered dietitian with the practice, the doses could be altered based on what your lab values are. So now I wanted to go over with you about the vitamins. The vitamin supplementation after surgery can be very confusing. There's a lot of products available. There's both bariatric formulated multivitamins, but then there's also just the over-the-counter multivitamins. So it can be very overwhelming when deciding which would be the best option for you. And depending upon the type of surgery that you choose to go with, the vitamin regimen may vary. So for a gastric bypass, for instance, the vitamin regimen is a little bit more intense, a little bit more involved because of not only the malabsorption that you experience, but the malabsorption because you can't physically actually take in enough food to sustain the nutrients that your body needs. So with the gastric bypass, the vitamin regimen would include a multivitamin, B12, calcium, vitamin B1, which is thiamine, and also iron. Okay. The vitamin regimen for the gastric sleeve procedure is somewhat a little bit more simplistic. Now, there may be an opportunity or maybe a point in time where, based on your labs, you might need more or less of a nutrient. But for a sleeve particularly, you might just need a multivitamin that you could take. You might need additional B12, but again, in some cases, generally we'll let you know if there's a nutrient that you need to take more or less of. So I have here in front of me several different brands. I have on the right-hand side here, these are bariatric formulated brands. I have Bariatric Advantage, Bariatric Fusion, and then another brand called Celebrate. Okay, and these are just some of them. There's certainly more than what's available here. But these particular vitamins are designed for this particular purpose. So they're designed for a gastric bypass patient or a gastric sleeve patient. So they're going to have nutrients in much higher quantities than what you would ever find in something over the counter. Because the over-the-counter versions are designed for a normal digestive system, which now you do not have. You have a much different digestive system. So you don't absorb the same way, and you certainly can't tolerate the same amount of foods. Or sometimes you may not even be able to tolerate the same types of foods anymore. Okay. So the bariatric formulated ones would be appropriate for this purpose. Now, depending on your practice, there's certainly some variability in the products that might be available from one practice to another. So make sure you contact the office, and that way you can determine what products are available for you. And then you'll also notice that most of these are actually chewable versions. Generally, in the first couple months after surgery, we recommend that you take a chewable version, just so that way you don't have to worry about large pills feeling like they've gotten stuck, or they're uncomfortable, or they just don't seem right. And they can also make you nauseous too, just because you're not used to taking them. So the brands, the bariatric formulated brands that I have here, most of these are chewable. This one is actually a tablet, a capsule, and this one is also a capsule. So there's chewable versions, which generally for the first 3 months you could do the chewable ones, and then as you feel comfortable swallowing the tablets and they don't make your stomach upset or anything, then you can switch to a capsule or even a tablet version. There's even a version of chewable tablets that look like little Starbursts. So these are little, they're called Chewy Bites. So this is another option if you don't like the chewable, chalky chewable version. Some patients don't particularly like those. And then the Chewy Bites end up being just that little sweet that you maybe needed to kind of get you through the day, that little pick-me-up. So then it's a little bit more enticing and also more enticing to take them because they actually taste good. Okay. The other option, aside from the bariatric formulated ones, would be the over-the-counter. So I have 2 chewables here. I have the Flintstones Completes, and you want the complete, make sure it says complete on the packaging, because this will actually have some iron in it. And then there's a brand new version of Centrum. This one is called Fresh and Fruity. It's a chewable tablet. And this one in particular, you want to make sure that you get the adult version. Okay, the Centrum Fresh and Fruity Adults. And it's chewable, so it's designed for adults. This one would be appropriate to have because it also will have iron in it. Okay. And then I have here, this is the very generic Equate version from Walmart, and these are just capsules or tablets. Okay, so that would be an option. Now, depending on which version you decide to go with, whether you decide to go with chewables, capsules, tablets, or even the Chewy Bites that I mentioned, all of those products have different doses. So just because the paperwork might say that you need 2 multivitamins, that may not actually be true, depending on what the product is. Some of for instance, there's the Bariatric Fusion in particular is 4 chewable tablets a day. So keep in mind that just because 2 multivitamins sounds like it would be enough, there might be some products where the doses need to be either more or less. So please make sure when you're deciding on a product that you let us know, so that way we can help determine the most appropriate dose for you and the most appropriate product for you too. Because I know sometimes when you're taking 2 of this or 1 of this or 2 of this other thing, it ends up being too many tablets, too many pills, it gets overwhelming. So you might be able to find a product that has majority of what you need in 1 bottle or maybe even 2 bottles instead of 5 separate bottles. Okay, because in addition to the multivitamin, that's more exclusively what I have here, like I mentioned, you'll maybe need a B12. So the B12 that's here is just a Nature's Bounty from Walmart, Target, any of the grocery stores. It doesn't need to be a high-end branded name, but this would be something that you would take. But if it's a bariatric formulated product, it probably already has that dose in it. So you may not need to do it in addition to. And the same thing with the thiamine. If you need to take the additional thiamine is going to be in the bariatric formulated products, more so than it would be in the general over-the-counter products. And the same thing with calcium. Okay, some of the bariatric products will have calcium in them. Some of them actually don't, and that's just because the chewable tablets would end up being really huge. So in order to keep the tablets an appropriate size, you end up having to do either multiple doses or you take the calcium separately. And there are some variations of the bariatric formulated products that contain iron and don't. So this could depend on the procedure, if you need the iron or if you don't. And then if the procedure that you had doesn't require you to have iron, but your lab values come back low, then obviously you can either incorporate a multivitamin that does have the iron, or you can take it separately. And that's something that we can discuss, when you follow up with your dietitian or the surgeon. And I know a lot of patients are really worried about constipation when taking iron supplements. There is a form of iron that is much better tolerated. It's called ferrous fumarate. Okay. And that form of iron is a lot gentler on your stomach, so you don't have to worry about the bloating and the constipation that you may experience with what's known as ferrous sulfate. Those types of products, or the type of iron, generally is a little bit more distressing on the stomach. So in most of the bariatric formulated products are going to have that ferrous fumarate, so it doesn't irritate the stomach as much. Okay. So as you can see, there are plenty of options for vitamins. This is certainly not an exhaustive picture of what's available. But again, it's overwhelming. So if you have questions about what would be the best option for you, please let the bariatric surgery office know. You can talk to your surgeon or your dietitian. And the one thing is that we recommend, if you're having this procedure, you absolutely have to take vitamins for the rest of your life. And there are some vitamin supplements that are not appropriate. Those would be gummies. Gummy multivitamins particularly generally do not have enough nutrients in them. Okay, they don't have enough in terms of dose, but then they also might be completely void of some of the nutrients that you need. Okay, so those are generally not well tolerated. Patches is another one. Vitamin patches we often have questions about. Those, unfortunately, there's some nutrients that can't be absorbed through the skin. Okay, so those we recommend that you don't go the route of the patches, as they may not be absorbed. And if they are absorbed, they may not be appropriately absorbed, so that you might still need to do supplementation. Okay. And then liquid multivitamins, sometimes those, again, kind of like the gummies, don't have everything in them that you would need. So the liquid version might be appropriate for the very beginning until you can tolerate the tablets or the chewables, but maybe not long term. Okay. So again, if you have any questions about vitamins, please be sure to ask your registered dietitian at the practice or even the surgeon, and we can certainly help find you the perfect product. Some concerns that patients have experienced, or some scenarios that kind of come up after surgery that may not necessarily pleasant or ideal, but one particular occurrence that can happen is called dumping syndrome. Now, this will occur particularly with a gastric bypass. Okay. With the gastric bypass, you have a portion of your intestine that's just been bypassed. So that portion of your intestine is usually where the absorption of fat and sugar would take place. Since you don't have that portion of intestine anymore, you don't absorb the sugar and you don't absorb the fat very well. So it can cause what's known as dumping syndrome. And exactly what happens there is the food just passes into the stomach a lot faster, into the intestine a lot faster, and you can't absorb it. So it creates this flush and an increase in water, and it flushes essentially the food through your intestine too fast. And generally the outcome is diarrhea. So not a pleasant scenario by any means, but something that can happen. And in addition to the diarrhea, you can have some gas, some bloating, abdominal pain, just that like cramping kind of feeling. You might feel like your heart's going to pound out of your chest. You might get this cold, clammy sweats. Okay. So it's not a pleasant scenario, and anything that is high in fat or high in sugar can cause this. So it would include cakes, cookies, pies, candies, sweetened beverages, so fruit juice, regular iced tea, regular lemonades, also regular gelatin. Okay, regular gelatin can cause this, sugar-coated cereals. And then there's even everybody knows that sugar and honey are natural, but those are still sugars. So you could still experience some dumping from those particular things. So if you add sugar or honey to your coffee or your tea, you could actually have some dumping from that. Okay. Your best option at this point would be to switch to an artificial sweetener like Splenda, Sweet and Low, Stevia, Equal, any of the monk fruit variations of sugar substitutes. So there's plenty of options for sugar substitutes instead of the original sugared versions that could potentially cause some discomfort. Now that's for a gastric bypass. Sleeve patients can still experience this dumping syndrome, but it's not as likely because you still have your intestine intact. However, for some sleeve patients, they can experience dumping because maybe they've eliminated these two types of foods from their diet in that immediate post-op time frame. So if you have kind of eliminated these sweets or these high-fat foods, and you have a French fry or two, just those two French fries can cause this dumping. Okay. Because your body's now adapted to not having the sugar, so it doesn't know how to manage it, and of course you end up feeling uncomfortable. Okay. So be very careful of high-fat, high-sugar foods that can contribute to this dumping, regardless of the surgery that you go with. Another concern or another experience that may occur is lactose intolerance. So this can happen, and I don't see it regularly, but doesn't mean that it doesn't happen. You might even notice that it seems very similar in symptoms to what you experienced with the dumping. So dumping syndromes were gas, cramping, bloating, diarrhea, where the three of the symptoms for lactose intolerance are gas, bloating, and diarrhea. So sometimes it can be hard to determine whether it was a dumping issue or if it was a lactose intolerance issue. You may notice this, the lactose intolerance particularly, in the full liquid stage, because that's where you're able to have milk and some of the dairy foods, yogurts even. So you might notice this lactose intolerance kind of appear during that full liquid stage. Some people are more or less sensitive to one food or another. Generally, when I hear about the lactose intolerance, it's primarily with specifically milk. Most patients can generally tolerate yogurts and some cheeses, but usually if they drink a glass of milk, that can cause the discomfort. So you might have to be a little bit more careful and cautious as to what products you use afterwards. To treat the lactose intolerance, there are alternatives. You can do the plant-based milks or lactate milk specifically. So you can do almond milk, soy milk. Soy milk will have the nutritional equivalent, roughly the nutritional equivalent of what cow's milk would be. Okay, where almond milk is going to have lesser amount of calcium and also protein. So it may not be you wouldn't be able to count it as a protein source like you could milk or even the soy milk. Okay. So the lactate products, if you get the lactate milk, it's just regular milk, and then they add the lactase enzyme to it. Okay. So that way you then have the enzyme that you need in order to actually tolerate the milk itself. The lactate tablets, those you can get over the counter, and then those you would just take prior to eating the meal that would have the lactose in it. Lactose is the sugar that's found in milk, and ultimately the issue that you're experiencing, that you're not tolerating. Okay. Now, for those of you that are including protein supplements, there are a couple different protein supplements. They're all kind of created a little bit unequally. So the protein supplement that would be the most ideal for someone who becomes lactose intolerant would be a whey protein isolate version. So whey protein isolate has the least amount of lactose in it. So generally in this case, for someone who would become lactose intolerant, the whey protein isolate version would be best tolerated. So make sure that you read the packaging of the product to make sure that it has whey protein isolate. If it's whey protein concentrate, there's still milk derivatives in it, and you might have some issue with that. Okay, and there are some protein shakes that are exclusively milk-based. So be careful that you're reading the label and the ingredients. And there are even some protein shakes that, although they're milk-based, they have the lactase enzyme in them. So those you might be okay with, and it'll say in the ingredient list, in the list of ingredients, it'll actually say lactase enzyme. So if you look for that, you might be okay. All right. Any other further questions about the lactose intolerance, or if you're not really sure, or if it's something that you're experiencing or not, please make sure you bring it up at your follow-up appointment with the dietitian. One of the last, probably more frequent occurrences after surgery is constipation. So the issue with the constipation is your bowel habits are completely different after surgery. We've possibly altered your GI tract, your intestine. So constipation is something that can certainly happen because you're not necessarily eating a whole lot and you're not necessarily drinking a whole lot. So to help alleviate the constipation, there's a couple tricks. So try to be as active as you can, get up and move around, try to stay hydrated, and gradually reintroduce the fiber foods. So fiber, you'll see that there's a list here: prunes, oranges, apples with the skin, bananas, raspberries, lentils, almonds, bran cereal, artichoke hearts. So there's some options here that are your high fiber foods, keeping in mind that there's a good possibility that some of these things is going to take you several weeks, if not months, before you would be able to tolerate them. So if you're not able to tolerate some of these foods immediately after surgery, your best option would probably be to have a fiber supplement. So there's two that are pictured here. There's the Metamucil. It's a 4-in-1 fiber supplement. There is a sugar-free version, and there's also an unflavored version. So you can decide if you want to do the unflavored that you can add to the food, to your food options, or maybe some patients I know like to add the unflavored powder to their protein drink or to their water, or or put it in their coffee, their decaf coffee. Okay. Or there's also Benefiber, same concept, different brand. Then there's even another product. It's a tea called Smooth Move. So the tea has a known laxative in it. So that might be, if you like tea, if you like hot tea particularly, that might be an option for you if you're not really interested in adding anything to water or to a beverage. And there's also chewable tablets. Fiber Choice is a chewable fiber supplement. So if you were to introduce or to include a fiber supplement, please make sure that you're getting plenty of fluids in. That 48 to 64 ounces that we talked about earlier, that's going to be really helpful in minimizing the constipation. Okay. And then as time goes on and you can reintroduce the fruits and the vegetables, your bowel movements should become a little bit more regular. If you happen to have any issues where you're not having regular bowel movements, or it's been 4 days or longer between, then please call the office and let us know, and we can kind of help navigate that and address it. To recap, we've talked about your 3 priorities after surgery: hydration, getting plenty of fluids in, making sure that they're not carbonated, no caffeine, and ideally calorie-free. In the 30-30-30 rule, making sure that you're not eating and drinking at the same time. And then we talked about protein. 60 to 70 grams of protein a day is ideal. That's what you're aiming for. And your protein sources are anything that comes from an animal. And then there's also beans and your dairy products. Then there's the 3rd priority, which is to make sure you take your vitamins. Okay, and we talked about the different supplements for the gastric bypass versus a sleeve. So make sure you're taking your vitamins every day. And then we talked about some of the more common experiences that patients have after surgery in relation to GI issues, which would be the constipation, the lactose intolerance, and the dumping syndrome. Okay, so in your packet for session 4, you'll notice that there's several questions. If you would go through your packet, answer those questions, okay, and have them available for your next appointment. And then your skills practice was to go through the list of protein sources that are in your packet, in the session 4 packet. Go through that protein list and highlight or underline, mark off the protein sources that you like. So that way you can start to build up your variety and make sure that you have just that for after surgery. And that way your options aren't so limited given the time, given some time after surgery, you'll be able to reintroduce most of those foods. And then you'll also need to schedule session 5. If you have any questions or concerns, please give the office a call. We'll be happy to help. Thank you.